Doc, Alan Lindeman. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. In today's topic, can you have a vaginal birth after a C-section? What is the
Well, they,
acronym for a vaginal birth after a cesarean section?
it's a VBAC or, vaginal birth after C-section. And yes, you certainly can have a VBAC.
Who can have a VBAC?
Well, there are three or four different groups. One is you have to have a horizontal incision in the uterus. That means from side to side, not up and down. One baby is a good idea, and a head first baby is another good idea.
Who can have a VBAC?
Well, it depends on the kind of incision that you have, but certainly if you have an incision which is up and down on your uterus, that's not a good idea. Also, if you have a presentation which is not head first, for example, breech or transverse lie, those are reasons to not have a VBAC.
Can I have an induction of labor with C-section?
Well, yes, you can. Years ago, we weren't so certain when we started doing this in the late 70s, but over time, we've realized that it's perfectly safe to have an induction. And of course, most of these inductions would be Pitocin and in the hospital.
What are the risks of having a VBAC?
Well, there are probably three. One would be uterine rupture. Now, I haven't had that in my experience. I've done hundreds of VBACs. A, uter- a uterine rupture would include um, usually involve vessels and bleeding. Then there's something called a uterine dehiscence, which is when the scar of the uterus, which is usually without blood supply, breaks open. That's not an emergency, but it is something that you need to repair. And then, of course, and this is something I haven't seen, but if you look through the literature on various sites, Mayo and Cleveland Clinic, they talk about infection. And I think infection is probably listed because of more pelvic exams and more monitoring.
What is the success rate of having a VBAC?
It depends on who you read, but most people would say it's about 75%. In my experience, it's been closer to 99%. I can't remember one VBAC that didn't succeed in a VBAC.
Is the rate of infection or blood transfusion higher for a VBAC?
In my experience, no. I have not noticed an increasing infection, but I'm always careful about limiting the amount of invasions. In other words, the amount of pelvic exams and the amount of monitors that go into the uterus.
When is a VBAC not recommended?
Well, obesity, preeclampsia, large baby, a baby that's not head first, and this one kind of surprises me. If you have an incision in your uterus, that in other words, your previous C-section is less than 19 months old.
What happens if the uterine ruptures occur?
Well, you can have a dehiscence, like I said. That's just a breaking apart of the old incision, and it's usually not an emergency. A rupture would be an emergency. It would probably involve bleeding and then possibly fetal distress.
Is a VBAC safer than a repeat C-section?
Absolutely. This has been known for many, many years. So certainly, if you have the choice of having a VBAC, take it.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Away, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys. Take care.